Good morning. My name is Jennifer Agluba, and I am a member of the Education Committee. I'm delighted to welcome you to From Alphabet Soup to Action, PT CPMDS for licensing boards. This session will highlight the work done by FSBPT's PT cross-profession minimum dataset task force to develop response options tailored specifically for physical therapy. The session will also provide a comprehensive understanding of how systematic workforce data collection can significantly enhance the perceived value of your board to key stakeholders. The speakers for this session are Mario Baker, Katie Britton, and Megan Warren. All three are members of the PT CPMDS Task Force. You can find their bios on the event app. They have valuable information to share, and we also encourage your participation. If you wish to ask a question during the Q&A portion, the members of the Education Committee will provide you with a microphone. Please abide by the ground rules in the program notebook so more attendees have a chance to ask questions. At the end of the session, please scan the QR code to complete your evaluation. We value your feedback. Now, I turn the presentation over to our speakers.
Thank you, and welcome everyone to talk about the alphabet soup, PT, CP, MDS. So prior to the PT, CP, MDS was just the CP, MDS, which is the cross-profession minimum data set. And what we attempted to do as FSBPT was kind of be a leader in this and getting other organizations, as you'll see in just a moment, to join in to get data on professions, including physical therapy. And then along the way, we decided that it was important to get a PT-specific data set so that we can ask more targeted questions towards PTs. This will be encouraged with other professions as well, so they can ask more targeted questions towards, let's say, nursing or OT, et cetera. So first Slido poll here, and if you take a moment to join, give you a second to click on the QR code. Okay. All right. Are you collecting workforce data as part of your license renewal? Yes. Okay. So a good majority of individuals are already collecting workforce data. There are a few that are not collecting workforce data. And we do have a slide that I'll show in just a bit on a roadmap in order to give you some guidance on how you can start potentially collecting workforce data. And I do understand, as we always say, there's 53 jurisdictions and there's 53 ways of doing things. And maybe we can show the value in this to the legislator for those that aren't collecting workforce data as of yet. So to go back, how did we go through this? How did we get this process started? It was through the Healthcare Regulatory Research Institute that this was created. And so jumping off of that, it led us to the shortages that are around. So as you've heard talked about and as you've seen also, we really didn't identify shortages as there are some individuals that renew their license and they just don't practice. And I'll show something from behavioral health that some of you have already seen. So what we got into was, this topic is debated in action in the area of healthcare policy making. It's been going on for a while. But we've been collecting surface data for those that have been collecting it on just individuals that renew their license. And we know that individuals that renew their license in PT, some may be purely in education and never touch a patient. Some are renewing it because they worked so hard to get it, and just in case they wanted to go back to practicing, then they would have it. Others renew it because I may want to practice part-time here and there, PRN. And then others are full-time equivalents that are working in the actual field of physical therapy treating patients. What is necessary here is to identify where shortages are so that we can do something about that and maybe target or promote those particular areas so that the public has access to physical therapy services. And this goes all the way back to why boards should do it. It is public protection. It really is. Because if we have something that we're able to offer to the public that is not being offered because of shortages in the area, then we can have maybe a rise in back pain or a rise in whatever that leads to the overall increase in medical costs across the United States. So if you look at this in this context, let's say there's a shortage of PTs in a particular area that are able to treat a certain condition, and then that condition or the individual with that condition, goes to all type of services and so forth, and never gets a remedy to the issue that they have that we could easily address, then obviously that'll drive up cost of healthcare. So if you recall back to the PT initiative from APTA, Choose PT, everybody remember that? And what was that all about? Hey, we have an alternative to the use of opioids. We can help with this opioid epidemic by having physical therapists treat individuals who have pain, chronic pain, etc. So the same idea exists. How can they choose PT if there are no PTs available? So we also looked at how the workforce was really stretched during the pandemic, okay, where there was a huge degree of burnout, and there was an exodus from the field of physical therapy from many professionals, some being PTAs, some being physical therapists, because of the pure burnout that they were experiencing during the pandemic. And in addition to that, the information that policymakers are seeking, and they find it very valuable to know about where healthcare workers are in their particular state, we can provide that information for them if we collect this workforce data. And then professional associations with limited amount of data may be able to use this information for sustainability purposes. So when we look at workforce data collection as a regulatory issue, well, first of all, number one, we have to look at states regulate healthcare, occupations in order to safeguard the welfare of their constituents. So we regulate this, and we're already looking at, making sure that everyone is practicing appropriately so that the public is getting good outcomes. Well, we need to know how many people are doing that, and if these individuals may be overextended because of shortages. Also, all licensees are going to need to maintain their license through a regulatory board. So as I stated earlier, some of us are already collecting surface data that I'll mention on the next slide here, but can we go a little bit deeper in what we're collecting without it seeming to be too invasive to the license holder, and get meaningful data out of that in order to make meaningful decisions? And then state legislatures' renewal periods offer a unique opportunity in order to gather this data. We renew in Ohio every 2 years, and it offers a unique opportunity every couple of years to get updates on where the workforce is, because it could change substantially in a couple of years. So we're not just taking it once and then leaving it alone. If we collect this on a regular basis, we continue to have our hand on the pulse of where workforce is in the area of physical therapy, and then hopefully beyond physical therapy. And then currently, no other governmental or private sector process offers this opportunity. Because of our renewals on a regular basis, we can get this on a regular basis, better than any other institution. And so what are we looking at? As far as regulation is concerned, we often are going to look at identifiers, their name, date of birth, social security number, address, license, qualifying, compliance, so looking at their education, exams, etc. This is stuff that's already being collected. When we look at the supplemental information, we can look at their practice, their role, their specialty, where they're practicing at, which is going to be key and important. The hours that they're practicing, are they full-time, are they part-time? Participation in the employment plans, and also population served and also service provided for those individuals. We can also look at employment arrangements and future plans, which is very important. Do you plan to retire in a couple of years, or are you planning on staying in the field of physical therapy? Also looking at educational pursuits, et cetera. So we're positioned in a place to where we can collect more data than just the basic information on our license holders. So as I mentioned at the very beginning, we have the FSBPT organization being a national champion for workforce data. They initiated this process to get other individuals on board, and you can see some of the organizations listed there: Association of Social Work Boards, you have the Association of State, and Principal Psychology Boards, you have also National Association of the Board of Pharmacy, etc., that are on board in order to collect this data through the CPMDS. So now we look at this cross-professional minimum data set as that tool, and it has 18 questions on the cross-professional minimum data set. And if we go on, there's 6 supplemental questions that are included there. And then this is a slide that you've seen, and it was presented yesterday as well, of how we can have a workforce and we're collecting data, but below the line, we're looking for how many full-time equivalents do we actually have. And so with this, what about the professional specific workforce options, which would be the PT CPMDS? And we started to form that, and I'm going to give you access to those questions in just a moment. But just a few of the members of the task force: we had the American Academy of Physical Therapy, we had the American Council of Academic Physical Therapy, we had the American Physical Therapy Association, and also board members and staff at several jurisdictions in order to collect, to give input, I should say, on what questions we should use to collect workforce data. So if you can click on that QR code, this gives you the 23 questions that we came up with that were approved by the Board of Directors at the Leadership Issues Forum, and you have access to look through those, and this is a part of the PT-specific minimum data set. And then I'm going to turn this over to our next individual.
Hi, everyone. I'm Megan Warren, and I am going to move forward. And I'm going to talk about how one state, the great state of Arizona, used some workforce data. And this was a report we did from our 2020 renewal data. And so this was the kind of details of the methods, and all of the results were presented at a previous FSBPT meeting. So I'm not going to get into those, although there will be a code for you to take a look at the full report. And let me go back and say that how I came to this FSBPT committee was based on the work we did in Arizona. The APTA nominated me for the committee for FSBPT. I am not a regulator. I'm a customer of the regulators. I'm a licensed physical therapist. So that's how I got involved in this. So in Arizona, let me take you back to February 2021. We all had a lot of time at home on our hands. And the Arizona Board of PT approved a data committee to look at some data. And so it included some staff members from the board, 2 board members, the Arizona APTA president at the time, and then 2 licensed PTs. Both Jim and I were faculty members at the time in Arizona universities, and we were all asked to be on this voluntary committee, and we all said yes. We met virtually 8 times over 12 months, and 13 months after the approval of this committee, we presented this report back to the board about the Arizona 2020 PT workforce. Where did those data come from? In April 2020, like Ohio, we renew our license in Arizona every 2 years. In April 2020, when we got our renewal notice, we were asked to complete additional data, additional questions. And those questions were about licensure renewal, our standard questions, as well as some demographic questions from an Arizona workforce statute. The law is posted down at the bottom there. There were 8 questions, and as I've said, I don't remember filling them out, so I don't believe they were terribly onerous to complete because I don't remember doing it. But they ask questions about when you were licensed, do you provide clinical care? In the next couple years, are you going to increase your number of clinical care hours, decrease your number, leave the profession, retire? Those types of questions. So there were 8 questions that were included back in our 2020 renewal. And so on the left panel here, right there, this stuff, there were about 5,400 PTs that renewed their license in Arizona and just under 1,800 PTAs that renewed their license. For the report, we excluded those who did not have an Arizona zip code or who had a missing zip code. We were really trying to get at who was living and working in Arizona. So now, since this time, I have left the great state of Arizona and moved 1 state west to the great state of California. So I would be excluded from this report because I'm not living and working in Arizona. The final count was about 4,600 PTs and 1,500 PTAs. I'll give you an example on the right panel of this slide of some of the results. These are all descriptive results. We tested no hypotheses. These were really to say, what's the state of the PT and PTA workforce in Arizona? And so you can see here, this is for PT. We did the same thing for PTAs. And you can see the dark blue bars are the proportion of PTs by different race and ethnic categories. The light blue bars are the state demographics for different race and ethnic categories. So you can see, looking at these, and there is a reason that white is over here because it blows off our axis. So you can see that PTs are a much higher proportion relative to the state population for white and Asian. And then if you look at the Latina, the proportion of PTs relative to the state population, there's a huge disparity there. Again, we're not testing any hypotheses, we're describing the state of the state. So this QR code on the left gives you our full Arizona state report, and it could prove some interesting reading for you. And we were really excited about what was going to happen with these data and what was going to happen with this report. It was submitted to the board in March. In May, it was posted on the website. In July to September, there were new rules that were enacted from previous legislation about data collection for all health professionals in Arizona. And that was, it fell under the purview of the Arizona Department of Health Service. And so the rules for the data collection, which are the data elements that are now being collected, are on the QR code on the right side. So Arizona had a law and then enacted some rules to change how and what were being collected. Here is the law, snippet of the law. Each board shall request from applicants for initial and renewal licensure. So now we're getting new licensees as well. On an annual basis or otherwise, the designated database information. And if you think CPMDS is hard, try Arizona Designated Database Information. These data will be housed in the Arizona Department of Health Services, and there is a process for specific state boards to request their data to look at. What I did here was looked at the PT cross-professional MDS and the Arizona designated database information. So I'm going to call it PT data and Arizona data because it's very complex, and said what's included in one and not in the other. How do the questions align? So as Mario said, there are 23 questions in the PT data. There are about 19 in the Arizona data. The PT data asks about state where you completed your license, states with an active license, and state of your primary practice. The Arizona data doesn't ask about any of those. It's interested in Arizona. The PT data also asks about specialty, field, and area of practice. And that includes specialty like our specialties, women's health, cardiovascular, sports, those questions. And then the population, adolescents, geriatrics. The Arizona data does not ask those questions. The Arizona data, on the other hand, asks questions that the PT data don't ask. One, national provider number, it asks. It asks if you provide services for people other than English language speakers. And then both data sets ask about the time you spend in clinical practice. The Arizona data also asks about the percentage of time that you spend in administration, research, teaching and education, and other activities. So it splits out kind of how you spend your hours in a week. At the bottom, you'll see two questions that are very similar, but they are slightly different between the two data sets. In the PT data, they ask about change in employment over the next 2 years. Are you going to increase your number of hours of clinical care, decrease, leave the profession, retire? What are your plans? In Arizona, very similar question, but it asks over the next 12 months or 1 year. In the PT data, it asks the highest level of education you've achieved. Arizona data, it asks two questions: highest level of education for your license, as well as highest level of education that you've received. So for me, my highest level of education for my license is a bachelor's degree, and then for my highest level of education is my PhD in epidemiology. So a little bit different. Again, I've completed these data in 2022, and our executive director of Arizona reminded me I completed them in 2024. I don't remember completing them, so again, they're not terribly onerous to complete. So the state board was going to use these data and kind of help understand. There's been some changes, and I think there's a really exciting opportunity with more data to start to say, what is the state of the workforce in Arizona? We also engaged the Arizona APTA. The president was on the original committee, and these data were presented at the 2022 membership meeting for the Arizona APTA. And their goal was to understand where people work as physical therapists and physical therapist assistants in Arizona. So you can see here, this is PT on the left side, PTAs on the right side. There's only 15 counties in Arizona, so it makes it very nice to display it visually. And so we're looking at the density. So this is the number of PTs per 10,000 population in each county in Arizona. The orange or rust color right here is the highest density of PTs in the state of Arizona, and that is a fairly, not densely, populated county of Coconino County. The thing about Coconino County, the beautiful city of Flagstaff, Arizona, my previous home is there. There's also a very large PT program in Coconino County. The purple are the next highest for PTs. Maricopa County is our population center of Phoenix, and there's several programs in Phoenix. And then down here, kind of this corridor here, this is Pima County, where Tucson is, another large population center. For PT assistants, on the right panel, you can see northwestern Arizona is the highest density of PT assistants. And in following what I told you for PTs, Mojave County has a large PTA program there. You can also see that we are not very dense in Arizona in PTAs, with the yellow and the red, which are the lower density. And for PTs, that eastern border over by New Mexico, there aren't a lot of PTs relative to the population compared to the rest of the state. But how do these compare with national data? So the Arizona APTA also looked to say, how do we compare? How does Arizona compare with everybody else? The top line of this table is the data that I just shared with you. This is for overall the state. 39 PTs per 100,000 population, 15 PTAs per 100,000 population. The APTA put out a workforce report, and you can see the numbers for Arizona there. They're slightly different, but again, we excluded people with an Arizona zip code, or people that didn't have an Arizona zip code. And when we were looking at who was working in Arizona by density, we excluded people that weren't doing clinical care. So people that were academic or administrators only, they were not included because they are not treating patients in the community. We think that probably accounts for the slight differences. You can also see that Arizona's density of PTs and PTAs is markedly lower than the average for the US. 39 or about 40, let's say, versus 68 per 100,000 for PT, and 15 versus 32 for PTAs. So markedly lower density. The Arizona APTA was very helpful for them to understand where they should be moving in the future. Demographic characteristics versus state demographics were also something that the Arizona APTA looked at. Other states' reports, and then there were some additional analyses, kind of brainstorming, and they'd say, why didn't you look at this? Well, because we had 8 questions that we were looking at, and that's what we were able to do. So I'm now going to turn this over to Katie, who's going to talk about, if you're ready to collect data, how to do that.
So a big thank you to both Megan and Mario for laying a foundation for us to help to realize that bringing workforce data into our respective states not only has value, but there is also a pathway forward that can help each of you take this concept from big and overwhelming to actionable. So the obvious next question is, are you guys ready for action, right? And if you're ready for action, let's get ready to bring workforce data to your state. Now, these next slides are for you, regardless of if you're starting from scratch, which it looks like maybe some of you are, or if you're already collecting data and you're considering additional standardization to your current data. So we wanted to take a moment to discuss both barriers and opportunities that you might experience in the process. So starting with opportunities. As stated previously, and as we all are aware, don't need to go into detail about this, better data is simply better, right? So the CPMDS is designed to serve as a framework for standardizing data collection across various health professions for the purpose of supporting within and between profession comparison and analysis. The output of any comparison and analysis is only as good as the data that's utilized to create those outputs. So why would the output of this data collection be useful, and what would you use it for? So to build on what Megan mentioned in Arizona, workforce data is widely seen as essential to inform policy, programs, legislative efforts, and even research. So some examples from other states. Some states are using this data to determine the number of schools and where those schools should exist, in what demographic regions. They're using the data to support legislation, such as requesting compact legislation to pass, or even direct access, just to name two very superficial ones, right? Workforce demand and availability analysis, which can be tied directly to some very important things, such as access to care and even healthcare outcomes in your state. They're using the data for justification for funding request. So for those of you who've ever requested more money, right? What's the first thing that they want to know before granting that? Show me the data. Let's analyze the data before ever considering that request. Other states are using this data to help your board with resources in terms of allocation and budgeting relative to the number of licensees in your state, and so much more. So there really is beauty in data, especially when the data helps demonstrate value. One example of demonstrating value is that this workforce data can help leaders to make informed decisions. And I hear this all the time from our state legislators. We need the data to help us to make informed decisions about policy. But specifically as a regulator, for you guys in the room who are regulators, you can show your value with this data. For example, in Louisiana, where I'm from, we are obviously, as a board, not allowed to lobby, right? No regulators are. But we are required to provide information to the government with data on the state of physical therapy. So being able to provide meaningful data that only we can collect because we have 100% of the sample size, right, is hugely valuable in providing our worth in an environment of deregulation. So also, there's an opportunity in that there is momentum here. Other organizations and states are seeing this topic as important. And we all understand making a move for change when the climate is right, right? I think we can all nod our heads about understanding how it has to be just the right environment when we want to move something forward. So because there is momentum here, right now might be the perfect time for action in your respective states. So really quick, in 1 or 2 words, you guys can use your Slido, because I wanted to put this here because we might all leave here, right, excited about action, bringing workforce data, advancing workforce data in our states. Well, what happens when, is it not working?
It should be.
It should be, okay. Well, what happens when we go home and present this request to the stakeholders and they drop a list of reasons why we can't really move forward? Do I have to press something to make it?
Oh, there it goes.
Good.
Oh, yeah, good.
There it goes.
Oh, I like the collecting this year. 2 people? Are more people answering? Oh, here we go. Excellent. Perfect. 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 So, a lot of what you guys put up are on this slide, right? So this slide are some of the top barriers that are reported by other states and other professions who've encountered barriers on this topic. So first, right, this is the big one, I saw it on the slide. Does your board see the value in collecting workforce data? So often, the first barrier to overcome is convincing your board or whoever your state's decision makers are, right, because not everybody is just managed by a board, that collection of workforce data is important and that it is a regulatory concern. So the key is to show the boards the value of collecting workforce data as it relates to evidence-based regulation and look for ways to minimize that burden, which we have some supports on with some references for you guys. Next, the big question, and again, I saw it on the slide, is do you have the regulatory authority to collect this data? Most states have powers and duties of the board and rules that define how they can act. And it may not be currently within your authority to collect this data and will require a legislative change. In a few slides, we're going to offer resources that are designed to help you overcome these barriers. such as Model Practice Act language that you can utilize, as well as references to other states that have already been down this road before you and can offer support and advice. And that's one beautiful thing about our profession, is how the states help each other, for people who've already been down that road. Third, how much will it cost and who will pay for it? So this may tie back to authority. Can you choose to collect fees for making this data available as one funding option? But there are other options. Data systems can be funded through state appropriations, private foundations, grants and contracts, and on a cost recovery basis, just to name a few. Also, the FSBPT can serve as a resource for funding and even has systems already set up to substantially decrease the burden of collecting this data, and also decreasing the impact on total time that it takes for licensees to complete. So fourth, who owns the data? What are the parameters around confidentiality, sharing, and data security? The recommendation here is that the data is public, that it's an aggregate form, and that there are no personal identifiers when that data is requested. This helps tremendously if you get pushback from licensees about confidentiality. And you can still extract the data and get the information that you need that's useful without having those particular identifiers. States like North Carolina are a wonderful resource on this particular topic, and even Louisiana, who went through this conversation with their licensees and stakeholders. Fifth, what should the framework be? Should it be a partnership with other organizations? Should you do it on your own? Who will collect the data? Will it be the boards? Will it be a university, a research institution, or even a professional organization? And what data will be collected? So, for all of these things, there really is no one magic answer that applies to everyone. But there is a ton of data to help you to answer these questions in terms of giving you options. Speaking with other states can really provide great insight and help you to determine what is best for your particular state, as well as you guys have access to a significant number of tools and resources, which we'll have QR codes for throughout the presentation that you can always come back to. But my QR codes, by the way, are like Google codes with the little dinosaur. I don't know, I guess I'm not technologically advanced to know how to make fancy QR codes, but they're there and they work. I tested them. But you're gonna have resources and tools through the HRRI website that really helps you to work through the process to help to determine what's the best fit for your state. Okay, so beyond barriers and opportunities, today we really wanted to provide you guys for some support for action. And we're gonna go through some of these areas and provide you guys resources. Who are the states that are collecting the data? Who are the other organizations? Where do we find the model language? What's the HRRI resources that are available? And also, what are the actual questions for the cross-professional minimum data set that are available for you guys as a tool that you guys have access to and can use for collecting workforce data. So, HWTAC, most people are familiar with this website, or organization. It's the Health Workforce Technical Assistance Center, and it really provides technical assistance to states and organizations that engage in workforce planning. So yet another organization that's a great resource. Now, the top QR code takes you to this website, and just note the data there is great. It is not updated as frequently as some other organizations because big government agencies, there's a time lapse, right? So the data there isn't 100% accurate as of today, but nonetheless, it's still really valuable information that really shows you what states are collecting data and what resources are available to you. On your left are a list of states that are currently collecting workforce data specific for physical therapy. And if you utilize the bottom QR code, which will take you to FSBPT's website, it will take you to several of these workforce reports for these individual states that you can read about what's happening in each individual state and maybe find a state of somebody that is similar to your state that you may want to have a conversation with. Of note, Louisiana is on the list, but it does not have a workforce report on FSBPT's website. But if you go to the Louisiana Board's website, you can find information on workforce for Louisiana. With respect to other organizations, you're going to see lots of references in these slides to HRRI resources and also FSBPT resources. But I wanted to note that on the last slide, the HWTAC, those resources will also clue you in to other professions that are collecting workforce data. So OTs, NPs, MDs, social workers, dentists, hygienists, there's a ton of people who are already collecting data on this. That can also be more people that you can talk to in order to have some conversations in terms of deciding what you need to do in your state. This is a repeat of Mario's slide. Just wanted to reiterate that there are organizations that are out there. So there are lots of people who are engaging in these conversations, and they truly do serve as a resource for you to help you to move forward in your own state. When the question comes up, do I have the authority to collect this data? Many of you, as mentioned before, it would require a legislative change, right, for you to have that authority. The resource available for you here are not only the other states who've been down this road before you, but also FSBPT has drafted language in the Model Practice Act as a really great starting point for you to look at, so that QR code will take you there. I want to reiterate that legislative changes are hard, right? They can be really hard. But there's momentum here, right? There's definitely momentum, not just in PT, but across the country. And so largely, the environment is right for providing a supportive opportunity for you to make a change. And I really do encourage you to grab those individuals from other states that are here this weekend and initiate those conversations with those individuals. This document, again, sorry for my little dinosaur QR code, but this document is pure gold if you haven't looked at it. So it addresses every question that I have raised throughout this presentation and literally walks you through the process step by step. It'll help you to critically think about your own state to determine the best path forward, all while supplying you even more resources and references. This is a link that will take you to HRRI tools and resources that also offer additional supports to the roadmap document. This is the link, you guys already clicked on it, that Mario gave you earlier, that takes you to the actual data for you to review. But I want to add one more piece to that. So on the HRRI website, you're also going to find not only the questions, but detailed commentary on each question, right? You'll also see FAQs that'll support you when you go and have conversations with other stakeholders and even for your own analysis. All right, my last thing is one last motivator, right? Because we're all about action today. So if you guys are anything like me, I get all excited whenever I come to a conference and I have an idea that I think is really great, and I know that I'm going to go home and remember all the details to be able to put it into action, right? And then when it comes down to actually putting the pen on the paper, I'm like, wait, I forgot exactly what I need to be doing to move it forward. So I wanted to provide you with one more resource that I think is very cool. It's a link to the Arizona Healthcare Workforce website. And what I love about this is it basically lists out current healthcare workforce initiatives in the state of Arizona that clearly would require workforce data to inform these initiatives. So it's not that it's specific to PT, but I thought maybe this list could inspire some creative thinking among you guys that'll help you to think of opportunities that might be worthwhile to create in your state and really support you to help getting forward and getting some momentum in your own state. Because the end point is that it's not just about data collection, but it's also about what we do with it. So our last Slido is the question for you guys. After hearing the three of us and myself talk very quickly, how important is it to stakeholders and to the public to collect workforce data? Yay! Aww. Very good. All right, so we have 10 minutes for questions. 6 minutes for questions or comments. And I think they have a microphone, maybe.
Yeah, so raise your
Yep.
hand if you have a question, and they'll bring the mic to you. I think we better stay there.
Okay.
Is there access to this information post-conference? Like, all your information? Do you know if your slides are going to be given to us to refer to?
Yes, the slides will be posted.
Thank you.
And just to let you know, so mine, I updated this morning with the QR codes, and so we'll make sure that you guys get the most recent information.
Question for Megan. You're in Arizona where you have compact. When you conducted that data for your licensees, did you take into account those compact privileges or getting any data on who from them or in your state?
I believe during the time, the time that we used the data, so 2020, we weren't part of the compact. Judy, am I right? Judy is the executive director of Arizona, so she's a regulator.
No, we did have the compact at that time. It's grown considerably year over year, but no, the compact information was not included in this simply because, well, for a lot of reasons, but mostly they don't renew in Arizona, nor do they, nor do we have access to them to promote these kinds of questions to send it out. I mean, I suppose any report going forward, because that won't change moving forward, so we'll have to put some sort of asterisk and say, you know, at this time, X number of active compact privileges were in place.
And then, but on the flip side, if people had an Arizona license and through compact were working somewhere else, they would not have been included because we asked the zip code of where they worked.
I guess that's one of my questions, the zip code of where they worked versus zip code where they are living. Tell me a little bit about that discussion, why you chose one over the other. And I can see that there's reasons for both.
Yeah, we chose a zip code of where they worked for just that reason, that people may have a permanent address, you know, and I think two of us brought up in the discussion, when I was a traveler, my permanent address was New York, where my parents lived. But I was traveling in different places and had licenses. So there could be differences in where people live versus where they work. And also in Arizona, we don't have like Kansas City, where someone could live in one place and work in another because there's a big city that kind of crosses boundaries. Our borders are pretty isolated. Yeah.
With the questions you've asked so far, are there questions you wished you would have asked that you didn't collect?
Yeah, initially, in our first 8 questions, we didn't ask sex. So we had race and ethnicity, but we didn't have sex. That would have been, you know, interesting to know to help describe the demographics. I think, you know, one thing we had to make some decisions about from the 2020 data were the people like myself who I worked more than 20 hours a week. I did some clinical care, but my main goal, my main role was in academics and in research and teaching. And so I think the new questions that will ask about the percentage of time that you do each of these things. So that will really help understand kind of FTEs that Mario presented from the behavioral health, what FTEs are available. So I think that would be helpful. And then in the Arizona data, the new Arizona data, for PAs, MDs, and NPs, they ask if they provide primary care. And they ask it of those 3 groups. It would be nice if there was something we could ask to get at what type of care PTs are providing. But again, it has to be something that can be applicable to a lot of health professions.
And I just want to throw in really quickly that there's a ton of questions about the questions, and it's a thought-provoking process. And so the resources on the HRR website that I mentioned, that not only has the cross-professional minimum data set questions, but also talks through the questions, why the questions are asked, helps to answer some of those I'm having thoughts about what questions should be asked. Super valuable, super helpful. A lot of work's been done on the topic.
I think we're at time.
We'll hang out for a minute.
Yeah.
Finish that with